Thank you. My name is Malusi Mpumlwana, the General Secretary of the South African Council of Churches. And I apologize for the glitches that we experienced this morning. And as it turns out, I was actually the last person to come in, which is even more awkward to find all our guests in the platform. But thank you very much for being here. We have come essentially to announce and launch our Religious Forum Against COVID, which is an interfaith initiative that all of us work together on, and we will therefore be having various leaders from different faiths expressing themselves on what we're trying to do together. This roundtable webinar is a roundtable precisely for that purpose. It aims to launch this forum and to look at, get to hear the commitments of each of our organizations, and then of course present something of the intended work over the next little while. There is an official media statement that will be released at the end of the webinar and will be shared with the media and the religious communities and the general public. And it's a media statement that has been prepared by all the members participating. We have a communication work group that's Interfaith that works on all these things and sets them up for us. I would like to invite at this time Matume Masha, who is coordinating the communication team. I would like to invite Matume Masha, who is coordinating the communication team, to give a sense of some of the things that we're hoping to roll out as part of this, the action work of the Religious Forum Against COVID. And then after that, we shall invite the various faith leaders to express themselves on what we're trying to do together. We also have, which is a very important part of this conversation, doctors who, because there is, we decided that one of the things that we would want to start out with is a conversation on faith and science, because we have a lot of questions in that regard. And I should say that we, the communication team, set up a survey that we used in all our communities. It came up with very interesting questions, some of which we shall want to share here, so that you get a feel for what some of the concerns people have. And the doctors that are in our midst will assist with some of those questions. Maybe I should just introduce and just say something about the sort of layout to the plan that we have for this webinar this morning. After my short welcoming remarks, I'm going to invite Ms. Masha to give a rollout of the work plan, and then we shall invite the religious leaders to make statements of commitment from their communities, and then we have a discussion. In that discussion, we will be opening it up to any questions members of our faith communities may have, not necessarily media questions at this point. And in that, we shall also be sharing some of the questions that have come through the survey that I talked about. At the end of that, we shall then have media questions, specifically a time dedicated to the media before we come to closure. So that's roughly the idea of how we're going to run today's meeting. Ms. Masha, would you be available to just give a sense of what's being rolled out as part of the launch?
Thank you, Bishop, and good morning to everybody. I am Matume Masha. I head up the communications here at the South African Council of Churches. And I've been working with the Religious Forum Against COVID-19 communication team in our communications plan towards our fight against COVID-19. So the forum is really a collaboration of different religious organizations and faith traditions in response to the increased ravages of COVID-19 in the country and within our faith communities. The religious communities have all been working independently to fight against COVID, but now we have partnered together to pool our influence and resources to fight the coronavirus as a collective. The purpose of the forum is to be a source of communication, clarity, and encouragement on COVID-19 matters in the interfaith network, while there is an active focus on the pandemic. And so the objectives of what we'll be doing is to amplify the spiritual messaging and prayers of the religious leaders in the crisis, continue communication on COVID-19 related matters, and really break it down in palatable formats and in ways that allow for the religious beliefs to also just be addressed. We will also work to contribute towards infection reduction, encourage vaccine registrations and jab within our faith communities, and bridge the communication and vaccine access gap in low-income communities. We also want to increase the emphasis of our non-pharmaceutical interventions, which is the wearing of masks, washing of hands, and sanitizing and physical distances within our faith communities and in our gatherings, and also just in our homes. Obviously, the gatherings when permitted, and to take control of the narrative and conspiracy theory and encourage social solidarity. So throughout the year, our rollout plan is a twofold plan, which will be our continuous communication as well as our once-off unique activations. So our continuous communication is really using our current communication platforms within the religious network to communicate to our audiences, whether it's via SMS, via our WhatsApp groups, social media, and in our physical gatherings, perhaps posters and things like that of matters around COVID, what new developments have emerged, and again, to really just explain and give our audiences well-informed information so that they can make informed decisions. And our aim also is to reach out to our low-income communities who sometimes don't have the information access. And so through our organizations, through our groups in those communities, to really train up people who are there to be well informed on any COVID developments, vaccine developments, and then to educate their or to inform their groups and then help them, assist them, whether it be with the vaccine or any COVID related matter. And so that will then continue in our continuous month-to-month communication. We will also, the forum will also increase its spiritual encouragement to the religious community. There is such a dire need for prayers, scripture reading, and encouragement for those who have been impacted by the virus. And so, as we've mentioned, that we have been doing work in our individual basis, but we've now come together to really just increase our work and to really just touch our communities at a higher stake. And then on the second, on our unique approach to, or the once-off activities rather, it will be implemented and planned as the COVID-19 developments emerge. Currently, we're focused on the vaccinations of our elders. Part of the hesitancies around vaccine is really just around, there may be some religious conspiracy theories. And so we are working, for instance, at the moment to really get our religious leaders to be vaccinated and to allow them to be considered for special vaccination, as they, especially those who work around funerals and are in those congregate settings where they're exposed to the virus. So those will be those once-off opportunities that we look at, so that we can then also encourage the religious community to see that the vaccine is safe, that our religious leaders have taken the step to be the physical example of or physical proof of what the vaccine can do, and or safety of it rather. And so these unique activities, or these once-off activities, will be, as I mentioned, planned and implemented as the developments emerge. Right now, our current focus is regarding vaccine of the elderly, of the religious leaders. And so to really just keep up with what we will be doing, it was just to engage in our social media platforms. We will engage with media on developments, and you will definitely be seeing more of this forum. Thank you so much, Bishop. Over to you.
Thank you. Thanks, Ms. Marsha. maybe it's a good moment to say that we would also wish to, the religious leaders have decided that there has to be a time that is dedicated to prayer, especially in the context of the third wave that the country is experiencing at this time. And that I will invite you towards the end to make announcements of as it is intended for the coming week. At this time, I would like to invite the religious leaders who are present. Some of them are still struggling to come in, but those that are here to make their statements, I'm going to invite Pandit Trikamji from the Hindu faith.
Oh, thank you, Bishop, and good morning to all my brothers and sisters today. Thank you for giving us the opportunity of sharing our thoughts with you, and also the opportunity of participating in what is a very, very important debate that we need to have as faith leaders. Yeah, I can start with the opening statement that, perhaps up to March last year, there were many in our society who we loosely call non-believers. And what has happened in the last 15 months is that all those non-believers, if not all of them, the majority of them have all become believers, because this pandemic has suddenly created that kind of understanding of what life is all about. So I think that that's a wonderful consequence, if I may say so, of the pandemic itself. But some of the issues that require some comment from us faith leaders is that, a lot of people are asking the question, what proof you got? You quite often on a daily basis, when you start to preach or you talk to congregations or you talk to people, they say, oh, what proof you got that there is such a thing as COVID, which comes from a rather simplistic position. I think the facts around the world, the entire world, and if people didn't believe if there was such a thing as COVID, then what's happened in all the countries in the world speak for itself. I mean, we are going through what is now called wave 3. And that in itself is more than proof that there is some kind of a pandemic, for better or for worse, call it COVID, or call it anything you want to. But there is some illness that is taking over our health situation throughout the world. Flowing from that, of course, is the debate about the vaccinations. Do we believe in vaccinations? And you get a lot of discussion and arguments and counter arguments against vaccinations. Many people are saying we don't believe in vaccinations and so on. As far as Hinduism is concerned, we regard life as sacred, and therefore that in itself consequently means that there is absolutely no prohibition whatsoever against vaccines. The side-by-side debate about vaccinations is that, we are, as society, making such a big an issue about vaccination now, when all of us, from the time we are born, have been subject to vaccinations. From the time that we are born, the time we go to school, in the first couple of months or in the first year or two in our schools, we are vaccinated against all the so-called diseases that are common, polio being one of them, chickenpox, smallpox, and so on. And yet, those of us who are fortunate enough to travel overseas, when you travel to a country, there are conditions for you to get a visa. And one of those conditions is that you have to have certain vaccinations, the most common one being yellow fever and cholera. We all take those vaccines. None of us ever question it then. For years now, there has been this annual flu vaccine, which is available, and the majority of us take it. So the debate about this particular vaccine is overemphasized in our view. A vaccine does only one thing for you. It protects you against the possible assault of your health system by at this stage, we call it the pandemic. So there we as Hindus certainly support the process of vaccination, and we have encouraged all our Hindus throughout the country to say, go and get your vaccine and make sure that if you get it the moment you have the opportunity to do so. There is, of course, the side-by-side debate about, well, where does it end? Do we stop at over 30 and over 20? And do we stop at over under 2? Why don't we take under 20? I think the view is general. With this particular third wave, even children are being infected. So the issue of vaccination for all of us, whether you are young, whether you are old, of course, as you are older, the chances are greater. Therefore, you have some kind of preference in getting vaccinated, but everyone should be vaccinated. I want to end with one little comment, which comes from our scriptures. What does Hindu scriptures say about so-called global pandemic? Right? Now, what the Hindu scriptures mention is that illnesses, diseases, and other calamities result as a direct consequence of the deterioration of human behavior. Right? One of the scriptures, the Ramayana, right, and the other one, which is well known to all of you, is Srimad Bhagavad, right, mentions that when the human behavior deteriorates, then you have what is called the period or a cycle called Kali Yuga, right, which is the age of coral that we are currently in, according to Hindu belief. So the Bhagavad, for instance, cites an example that says that religion, truthfulness, cleanliness, tolerance, mercy, duration of life, physical strength, and memory will all diminish day by day because of the powerful influence of the age of Kali. That age is what we call the dark period, the negative period in our lives, right? Society will suffer greatly from all kinds of illnesses, cold, wind, heat, rain, and snow, right? And they will be further tormented by quarrels, hunger, thirst, disease, and of course, severe anxiety. So the next question is, if that is the case, should person who believes or follows or is the devotee, right? What do they do when these events take place? I think that's probably a very good question that can be asked. And our scriptures say, well, in that instance, believers should reflect on their own behavior, right? Reflect on your own behavior and take the steps that will bring about your conduct in line with what your scriptures teach you. At times like this, believers, followers, devotees are especially reminded of the qualities of purification. That's both spiritual and physical, right? Self-control, simplicity, cleanliness, right? Which the Gita regards as belonging to one who has a divine nature. So we should all engage in prayer and devotion, because at the end of the day, prayer and devotion is our strength in dealing with this challenge of the virus. Colleagues, I thought I'll just make those comments to start as a small contribution to the debate that we're going to have later on today. Bishop, thank you very much. And again, to all of you, thank you for listening to me.
Thank you very much, Pandit Sreekamji, and also for sharing not only the messaging that every South African should hear, but also mounting it and anchoring it in the faith tradition. Thank you very much. That's what we're about. Thank you, sir. Now, shall we invite Elder Msane to introduce himself and address us?
I hope I can be heard. My name is Sibongiseni Ephraim Sane, and I'm currently residing in Johannesburg. I'm one of the area 70s for the Church of Jesus Christ of Latter-day Saints in the Africa South area, which includes 13 countries. Just briefly, in terms of what in the role that I have, we do is work with general or worldwide leaders of the church acting in the name of the Lord Jesus Christ under the direction of his 12 apostles in building up the church and regulating all the affairs of the same in our area. As a church, we acknowledge the COVID-19 pandemic as a serious challenge that humankind needs to work together, seeking and following divine direction to overcome. It is in the spirit that we are members of the Religious Forum Against COVID-19 and fully support its communicated media statement, which will come through at the end of this webinar, and encourage the religious group commitment in the fight against COVID. We urge all the people in our beloved country to constructively engage themselves in this fight. And I would just like to make one or two other comments. Vaccines in this country have a history, and I'm grateful to Advocate Trikamji for his words and expanding a little bit even at this time on those vaccines. But it's our view and our belief that God provides assistance to all of us in a number of ways. And the reason we support vaccines is because we understand that they can also be a blessing like any other medication can be. The only thing we caution on as a church, being a Christian church, and making sure that we do things as the Lord and our Heavenly Father would have us do, is just make sure that we're using medicines for medicines. We're not linking them to spiritual things that might not go with the gospel of Jesus Christ. But otherwise, as we best understand what has been developed here as vaccines, we truly and strongly encourage everybody to take these vaccines and make sure that they are protected against this COVID-19, which we all know by now is actually very deadly. And it's important that we do what we can to protect ourselves and those that we love through vaccination, the non-pharmaceutical regulations that we have in place to ensure that we are saved as much as is possible and as the Lord would actually allow. And this for us is quite important. And I thought I would just say that, but yeah, we will hear more, I'm sure, as we get into discussion. Thank you, Bishop.
Thank you very much, Elder Msane. We now invite Maulana Abdul Ali. I think I think that Rabbi Chaikin is back. Okay, we start with Maulana Abdul Ali. If you'd go ahead, please, esteemed leader. From the Muslim Judicial Council. Is muted. Please unmute the Maulana. Thank you. Hello?
Hello.
Yes, thank you. Thank you. Now we can hear you.
Okay. You want me to speak?
Please address us now. Yes, thank you.
Good morning.
Good morning, sir.
Shalom. Molweni. My greetings to one and all. Goeiemorgen. We come together as a faith community, standing together in the spirit of brotherhood, addressing the issue which confront the global community, which has been the cause of death of many people through all the power and the will of the Almighty Allah. Today, as we've gathered here as a faith community, we are wanting to showcase to fellow South Africans the urgency which we as a faith community is seeing this particular pandemic. And we would want people and the masses in South Africa to identify with this particular urgency which we as a faith community are dealing with COVID-19. And as such, under the leadership of Bishop Malusi and the rest of the faith leadership, we have consulted, discussed, debated, and spent much hours with the concept of how best do we as a faith community put our strengths together and our energies together, and that we can be able to work together for a message of hope, a message of compassion, a message of almost solidarity with fellow South Africans, but at the same time also a message wherein we appeal to fellow South Africans to say that the concern that you have is not a concern for yourself. When we speak about adhering to regulations, adhering to protocols, adopting the stringence of measures, it's not meant only for you. It is meant for your beloved mama at home, for your beloved papa at home. It is meant for your loved ones at home. But equally, it is meant for your neighbor. It is meant for your neighborhood. It is meant for your fellow South African. It is meant that we as a South African people can be able to rise to the call of the Almighty Allah that speaks to us, that appeal to us. And He says, seek cooperation and help when it comes to matters of righteousness and goodness and piety. And in this instance here, we are addressing the issue of the preservation of life, the matter pertaining to the value of life, the well-being of each and every single individual. And therefore, as a Muslim community, our humble appeal to our fellow faith leaders, to fellow South Africans, and to all others who are living in our beautiful rainbow nation, our appeal to you is that let's join hands. The faith community is here to provide guidance. The faith community is here to assist and to ensure that we overcome this particular pandemic as a collective. We make the effort as a collective so that we can be able to achieve, to flatten the curve, the third wave that we're experiencing. How can we be able to flatten this particular curve? By working together, by sharing our sentiments, by sharing our thoughts, by taking hands. And today, the 1st of July, this day is a manifestation of faith leaders coming together to say to fellow South Africans, please people, let us adhere to all the protocols. Let us mask up. Let us keep to the regulations. And at the same time, let us be able to have consideration for your fellow South African. By you taking care, you are taking care of your fellow South African. By you adhering to protocols, you are caring for your fellow South Africans. You are caring because that is what Allah Almighty wants from all of us. We would like to acknowledge our frontliners in every sphere of our community and society. As I'm speaking to you, I'm coming from the historic Bo-Kaap community as I'm speaking right now. And we are attending a funeral of one of our senior leaders who passed away yesterday. And the spirit of our togetherness is one that we must be able to celebrate as a South African community. I thank you for this wonderful opportunity. We have drafted a document. The document is issued in the spirit of this amount of energies and goodwill that it is expressing here to the South Africans. And we hope and pray that Almighty Allah will He hears our prayers. He sees us. He knows our conditions of our hearts. He knows that we are sincere, that we are wanting to showcase the readiness to work together for the well-being of South Africans. I thank you.
Thank you very much, Maulana. Maulana Abdul Ali is Deputy President of the Muslim Judicial Council. We now invite Rabbi Yossi Chaikin, who is the President of the South African Rabbinical Council of the Jewish Faith.
Thank you, Bishop. And thank you all for this amazing, wonderful initiative. As mentioned, my name is Yossi Chaikin. I'm the chairman of the South African Rabbinical Association, which represents the Orthodox rabbis across the country. I'm here on behalf of the Chief Rabbi of South Africa, Rabbi Dr. Warren Goldstein. Unfortunately, wasn't able to be here and asked me to represent him. And it's very exciting to be part of this initiative because so many of the things that we've been doing in isolation as a faith group, which I want to share with you, we now join together across faith groups for this fight. Clearly, in the Jewish faith, the Jewish religion, we are committed in the synagogue to this fight against COVID-19. And we've been doing this since the very beginning, and it's exciting to be doing this together with others. We've been very involved in educating our community about COVID-19, initially to encourage people to understand the importance of those so-called non-pharmaceutical interventions, of masking up, of social distancing, of staying away from gatherings, which require a lot of education. It's a huge paradigm shift for a community where you're very, by nature, a community that's very much into gatherings, large gatherings, partying, celebrating, worshiping together, sitting and eating. And this has been a very, very big adjustment. And the faith leaders have been very important at the forefront of this encouragement. And more recently, encouraging the community with the vaccination drive. Sadly, there is anti-vaccine sentiment everywhere. No community is spared from that. And there are people who are quite hesitant to take the vaccination. And rabbis have been at the forefront of explaining to our communities the important necessity of going out to be vaccinated. Some people are very, very laid back about it or concerned. And yes, I think that having a high profile drive for religious leaders to be vaccinated, in a very, very high profile fashion, covered by the press, would go a long way in our communities, respective communities, seeing the necessity, the importance of vaccination. Our thinking philosophically in Judaism is based on the words in Exodus chapter 21, in the original Hebrew, v'rapo yirapeh, he shall surely heal, which is the obligation of the doctor to administer medication and of the patient to follow medical advice and medical intervention. Maimonides, a great philosopher and legislator in Jewish law, who was himself a physician, a doctor, states clearly in his works that being healthy and keeping your body healthy is one of the ways that we serve the Almighty God. That's what's animated us. We're very fortunate to have a group of volunteer paramedics, medics, etc., that work within the community in two ways. First of all, monitoring the actual number of cases in our community, and that is important. When you educate people, you want to tell them it's important to, shelter at home, that we're not giving them vague numbers that affect the entire country. 19,500 or so new cases is a staggering figure, but it's national. When we talk about the cases that have affected your particular community, you neighbors, the people you socialize with, it is far more effective. These volunteers have also been helping to try and keep people out of hospital by monitoring them as long as possible in their own homes and organizing home oxygen programs and so forth. And because we have this data, we're also able to track our specific community. And so we, for example, decided to close our places of worship a couple of weeks ago ahead of the mandated government lockdown because we have access to these figures. So having these doctors advising us and some very high profile people within the Jewish community advising us has been extremely helpful in terms of micromanaging it and giving advice that is specific. We've been badly affected by the prohibition against faith gatherings. There's no question. Much of Jewish worship happens in the community, happens within a quorum of people gathered in one room. And so much of our religious worship has not been able to take place, and we've had to find workarounds. And I'm going to say this, every time there's a lockdown and we have to close places of worship, it becomes more difficult to get people to come in. They get out of the habit. Regular worshipers who were coming weekly or daily even, and are out of the habit, and it's difficult to bring them in. And whereas I agree with my esteemed colleague earlier that there's been a return to faith by many, motivated by fear and understanding, and I think this has all forced us to recognize that there is a greater power above us. But it's forced us all to recognize this and return us to faith. At the same time, we've had people losing their faith because they've lost close ones, and it's been very difficult to keep faith when you experience loss, and it's been a challenge for us. We've made extensive use of online worshiping gatherings, prayer meetings, educating our community. We have ongoing webinars for the Jewish community within individual synagogues as well as the wider community as a whole. And we've also gone out there and attacked it from the social point of view, reaching out to people who are alone, the ill, but also people who are perfectly healthy but sheltering at home, and very lonely, particularly those who are single and alone in their homes, or even couples who haven't got family in the country. And we've had to reach out to them because loneliness is a terrible, terrible condition, and one that can lead to really harmful mental health considerations. So these are the things that we've been doing within our community, and we really welcome the opportunity of now joining forces and joining hands with brothers and sisters across the country to fight this together. Thank you, Bishop. Thank you all.
Thank you very much, Rabbi. That is very inspiring. Thank you very much. And we are, before we go to Archbishop Shabalala, who needs to be reconnected from the believers in Christ, I just want to say that the texts and the references to the scriptures that our leaders have been using does indeed anchor us in the religious practices of our faiths. And of course, COVID-19 has taken its toll on that, as the Rabbi was just reminding us. Members of the religious community had to adjust and sometimes sacrifice their worship. Religious practice is a need for many South Africans. It's not something you do for entertainment. It is a source of strength for their spiritual, their mental, and at times physical well-being. We shall be going into some of the discussions related to this. There's a debate on the stance of religious leaders on physical gatherings, whether they truly perceive it as a COVID-19 spreader, and if there is a way for physical gatherings to continue while keeping the community safe. We did a survey which was circulated amongst all our various faith traditions. And it would seem that Bishop Shabalala would like to have Dr. Bongani Mzimela speak on behalf of believers in Christ. So please, Dr. Mzimela, speaking now, not so much as a doctor, because we were going to have the doctor session just now, but making a statement on behalf of the community of faith.
Good morning, everyone, and good morning to Bishop Mpulwana. I am speaking on behalf of the Archbishop, Professor M.M. Shabalala. Our founder is on the bridge, but unfortunately is feeling a bit under the weather, so he's unable to speak. He is the founder of our church, Believers in Christ. He is also a leader of Ikale Zayoni, a youth forum. He's also the current leader of the Benevolence Church in terms of leadership, and is a member of the Organization for the African Independent Churches, which is the OICs. With all that and all those engagements being said, as the founder, Archbishop M.M. Shabalala says, we are endorsing and we are supporting the South African Council of Churches in its attempt and efforts to try and unify all leaders and church leaders in the fight against COVID-19. The population that we are representing is a population that is quite diverse in nature. Most of it, because these are mostly independent churches, comes from the deepest rural areas where it is quite difficult to allay information. So the efforts that the church is making is more than welcome to support all efforts to try and mobilize as many people as we can in the fight against COVID-19. As a church, we have experienced firsthand the difficulties around COVID-19. We have lost some of our members and we have lost some of our loved ones. We have been quite in the forefront in the fight against COVID-19, and especially in adhering to the protocols. Those who have been following the church on all our social media space are aware of how strict and how far we've come as a church in fighting against COVID-19, mostly in trying to encourage everyone to adhere to the protocols that the government has put in place. With the difficulties of the number restrictions, we had to cut down on our branches and actually even divide into having separate services so that we adhere to the rules. We have also been quite in the forefront when it comes to attending funerals, especially our leaders, our bishops and our pastors have been involving in the pastoral care and following up and looking after all those who have been unwell because of the COVID-19. As a religious structure, and because of the diversity of the structures that we are representing, we are aware that there might be quite a few challenges when it comes to having a unified message of support, especially if you look at the worship style that Amazayoni generally have, and you look at the perception that most people have about Amazayoni in general. We are attempting and we are going to be behind the South African Council of Churches in making every effort to make sure that the messages will reach to the deepest areas and there will be messages of encouragement and messages of support. What COVID-19 has taught us as a church is the ability of leaders to be flexible, the ability of leaders to adjust to different situations, but most importantly, it has taught us the power of the Holy Spirit, that God can still be with us in the comfort of our own homes, and God can still be worshipped through other spaces without the physical contact. So that is what the ARC wanted to say. Most importantly, to say he is behind this initiative. He is very happy with the initiative that the South African Council of Churches has come up with, and he hopes to see it being successful going forward. Thank you so much, Bishop. Mpulwana.
Thank you, Doctor. Knowing that you are a pediatrician, I do not want to complain about what might well be the parents of the children behind you. But we were able to hear you very well. I'm sure everyone did. I just think that maybe we should go to some of the questions that have come up in the survey. Very fascinating questions people are asking, and matters that people are raising that I think needs to be responded to, especially because there's a lot of people that are on the Facebook platforms of all our traditions that are listening for those questions. Remember that questions came from all our traditions. So there were questions that came from the Hindu tradition, from the Muslim tradition, and so on. And so all of these have got people waiting here what being said. Some of them are questions of faith meets science. Other questions are questions of faith other questions are directly medical questions. And so we're going to try and cover as many of these as possible. I think I'll try to kick off with the question of exasperation. Somebody says, sometimes it feels like God is absent in all of this. Why has God allowed this pandemic to drag on for so long? So many are suffering and it feels like it will never end. I would like to invite the faith leaders to speak to this one because it's not about doctors. And I'm going to get to the doctor's question in a moment. If there is a faith leader who would like to speak to of God.
Bishop, can I answer that or try to answer that?
Yeah, please.
Thank you, Bishop. Yeah, so I thought I did cover some aspects of it. Perhaps I might elucidate. I did say in my submission that pandemics and illnesses and so on are a consequence of the deterioration in human behavior. And this results in the kind of challenges that we have. The question about why is it so long? I think people are forgetting that historically we had the Spanish flu, which lasted for a couple of years. And at that time, there were almost double the number of people who passed on as a result of that flu. So perhaps we may be just overreacting, and because this is a completely new phenomena that we faced with, when we say, oh, why is it going on so long? Why is God not intervening, so to speak, and doing something about it? So that would be my response, that it's not as long as we think it is, because there have been other pandemics which have gone on for longer periods of time. And I think we are just reacting because of the situation that we find ourselves in. Thank you.
Thank you, Pandit Shukamji. And maybe there will be another leader that wants to say something about that, and otherwise I'll move on to the next question.
Can I also comment on this?
Yes, Elder Msani.
Yeah, I will add to what Advocate Trikamji was saying just now. We also need to realize, as people of faith, that our Father in heaven, God himself, has given us an environment within which we need to grow and in some ways make our way back to him. I think we all agreed in the different faiths on most of it. But he also allows us to decide how things actually work out as we work our way through. So where I'm going really is saying some of the things that we put to God as he's causing them, we actually do cause. If we take the pandemic as we have it now, and in fact, a lot of what has already been said, even in this meeting, we have leaders here encouraging all of us to do the right thing, which is actually take the vaccine. Now, if I choose as an individual not to take the vaccine, which I can do because it's my agency, it's my choice, and the vaccine was going to protect me. Now I don't have that protection, and now I get sick, and now I pass that sickness on to other people, and they also get sick because maybe they are also not vaccinated. That progression of the disease and the time it then takes cannot necessarily just be put back to God. We also need to accept some responsibility for the choices we've made, which have caused the disease to last longer than it might have if we had behaved differently. Now it gets even more complicated with the vaccines, if I can just talk a bit of science, though I'm not a doctor, in that the longer it goes, the more it mutates. So it actually gets complicated when we're not doing the basic things, the right things that we need to do to guard against it. And that's not only do we have a longer time, but we have more sickness and even fatal sickness. So I just thought I would point that out, that our choices have a lot to do with this as well. Thank you, Bishop.
Bishop, if I may weigh in quickly on the question, one of the things I've learned in my decades in the pulpit is that though I advocate for God, I never speak for him. Nobody can explain the Almighty's ways. They're unfathomable, and we don't really want to believe in a God that can be kind of boxed into a little intellectual brain, because his ways are much beyond that. And the question is not, especially without the benefit of hindsight and history, to explain why, but rather to take every situation and preach about how we must deal with it. And with all the pain and the loss, what the positives have been. In terms of faith leaders, the fact that there's been, as I mentioned earlier, a recognition of the total lack of control of our own lives, and the fact that we are, really at the mercy of the Almighty God. The fact that we have felt united and couldn't live in isolation within our respective faith communities, race communities, even countries and borders, because that virus kind of doesn't know any limitations. And our actions affect everybody, has been a huge recognition of unity. So within all of the darkness and all of the pain, there's been such amazing beauty of heroism from our frontline workers, from our religious leaders, from strangers who have helped one another, supported one another. And we need to focus on the positives and preach a message of how we act rather than what is happening, which we're never going to be able to. Thank you.
Thank you very much, Rabbi. That's very helpful. I'm going to put a question that goes to the doctors. And it is really, I think, for everybody's benefit. Please give a quick overview of how vaccines work. What is the history of vaccines, and what other vaccines do we currently take that are safe, and how are they different from COVID-19 vaccines? Now, while the doctors are figuring out who is going to speak on that one, I will just make a comment that probably rounds off the conversation about the debate between faith and science. There's a lot of people will say that science. There's a question here, for example, that says, "Will I not compromise my faith if I take the vaccine, because I'll then be using science?" And I think that we need to broaden the understanding of our use of science beyond just the vaccine and medication, because science is essentially just a way of understanding how nature functions and how the various elements of nature interact with one another. And we do that and then use it to develop tools and instruments that make for our living, and whether we're making food, processed food, whether we are making clothes or even vehicles and cell phones, even this platform, it's all about science. And sometimes we want to think about science only in the context of medications, and when in fact everything else that we do is scientific. But that's probably an important consideration, in that all of us in our faiths do believe that human beings are created in the image of God. And if God is all powerful and creative, certainly that creativity is also an element of being human. And therefore science is one way in which we exercise that creativity. And in this regard, there is nothing that we do. In fact, science becomes a gift of God to humanity. And that is why we enjoy the benefits of science in every way possible, even in the learning of languages that we don't grow up with. It's all happening through scientific mechanisms. I want to invite the doctors to speak to us about the vaccines. Give us an overview and give us a bit of history, and give us, just so you have a sense of who the doctors are in the room. We have participating here today, we have got Dr. Ray Bila, who is a group medical officer for Clinics Health Group, coming from the Evangelical Alliance Health Commission. We have got Dr. Bongani Mzimela, who already addressed us on behalf of Archbishop Shabalala. We have got Dr. Nodi Jinabang, who is a former professor at the University of KwaZulu-Natal, and is now a consultant and researcher coming from the South African Hindu Mahasabha. And we have Dr. Hafiza Chenia, who is a medical microbiologist and a senior lecturer, and Dr. Chenia comes from the Muslim Judicial Council. And I thought, I thought we had a Jewish doctor here as well. I've not been given the name. So any of these doctors who feels comfortable speaking to us on the culture of vaccines, the origin of vaccines, the development of vaccines, and what their efficacy would be, please address us now. A quick overview of how vaccines work, history of vaccines, and what other vaccines do we currently take that are safe, and how they are different from COVID-19 vaccine.
Thank you. May I start?
Thank you, Dr. Jinabai.
Thank you very much. Firstly, thank you to the South African Council of Churches and all the faith leaders. I acknowledge them, and thank you for this wonderful initiative. Very briefly, vaccines have been around for over 1,000 years. They were first used in different forms in China and India in the East, and then over the last 2 or 3 centuries, various scientists and health professionals, medical practitioners discovered the value of that in the Western world. The way in which vaccines work is that our human body, our biological system has a defense mechanism that is inbuilt in our physiology and biological system, which is the immune system. And the immune system is made up of different types of cells in the body, which are there and they're circulating daily, 24/7 throughout our body, throughout all our tissues and organs, looking out for any foreign invaders. In the form, one form of foreign invaders are viruses, bacteria, fungi, etc. Any foreign material that is coming through into the body. And particularly, they're looking for the viruses and the bacteria and the various other microorganisms that may invade the body through the skin, through the oral, through the nasopharyngeal system, the nose, the throat, the breathing, the respiratory system, through the mouth, then the oral cavity into the stomach, etc., and any other way in which these microorganisms may enter the body. So these immune system and the cells that make up the T cells and the B cells that make up the immune system will then interact with the foreign microorganisms and then eliminate them in different ways. So that's the basic essence of the immunology of the way in which our innate immunity and our cell-acquired immunity, there are two types of immunity that we have, is able to detect microorganisms or any other foreign bodies in the body, in any part of the body, and eliminate them through different mechanisms. The main impact it has, the main mechanism is that the cells, when a foreign microorganism enters the body, it initiates an immune response. And the immune system, which is the defense mechanism of the body, then kicks into action and starts producing different types of cells which attacks the microorganisms and either destroys the microorganisms and eliminates it from the biological system completely, or it overwhelms and prevents the mutation and the further growth and spread of the microorganism, be it a virus, a bacteria, or any other microorganism. It prevents it from spreading in the body and causing any destruction, any damage, etc. This immune response is very important to understand, because it is the immune response that also, unfortunately, if it's triggered too strongly, can also have certain side effects, negative side effects on the human body, which I'll briefly mention. So the purpose of the vaccination is very simple. It is to inject or introduce a very, very tiny amount of this microorganism, be it a fragment or a small piece of the microorganism, which is made up of either the RNA or one of the protein molecules, etc. So the way in which vaccination works is we would take a very small part of this microorganism, its protein elements, inject that in the body and stimulate the immune system to react and to build up the antibodies against that particular microorganism. And therefore, if in the future, subsequently, a similar or a variant of that microorganism enters the human body, then the immune system, the defense mechanism of the human body is ready, it is primed, it is ready to go into action and immediately either eliminates and destroys the invading microorganism, be it a virus or a bacteria, or it then prevents any further damage and prevents the vaccine, prevents the foreign invader, the microorganism, from overwhelming the body. So that's briefly the way in which vaccination works. And the vaccination could include either a small fragment of that microorganism, or in some cases, the virus can be attenuated, that is, its virulence and its potency can be removed through various chemical means, and either dead microorganism or an attenuated microorganism or a virus can be used to stimulate this immune response in the body. So that's very briefly the way in which vaccines work. So if we are vaccinated, what it means is that the body's immune defense mechanism is primed and ready for that particular vaccine, in this case, the COVID vaccine. And if the COVID virus enters our body, if our body's defense mechanism and immune system is primed and ready, then two or three things happen. The first thing is the potential for the COVID virus to overwhelm the body, particularly the respiratory system, the lungs, the other body systems and the organ system. Its ability to spread and multiply is greatly limited. And therefore, the morbidity, which is the side effects of the viral infection, are greatly reduced. And therefore, most people would probably have either a mild to a moderate infection, and the body's immune system will then eventually, over a period of days and weeks, overwhelm that microorganism, and they would not have any serious illness. The second very important impact, which is the efficacy of the vaccine, which has been proven through many scientific studies, is that it reduces mortality, which is death. So one of the most serious side effects, the most serious side effect of any infection is eventually the virus or the bacteria, in this case, the COVID virus, overwhelms the organ systems, the cellular mechanisms, the organ system overwhelms the body and eventually causes the death of the person and causes mortality. And therefore, the vaccine has been proven to reduce morbidity, which is severe infection and hospitalization, and secondly, greatly reduce mortality, which is death from the particular COVID virus. So that is the scientific rationale and the basis on which, from a public health and epidemiological perspective, vaccination is absolutely mandatory. In some countries, even in South Africa, certain childhood vaccinations are mandatory by law, and it is we need to strongly encourage all the people of our country and of our planet to go ahead and receive the COVID vaccination to reduce the morbidity and the mortality. And of course, we've mentioned several times the spread. One of the unique features of COVID vaccine is that it is spread from humans to humans. We do know that it jumped initially from some animal host into the human population, but currently the vaccination is spread from humans to humans. There's no other vector like mosquitoes or ticks or dogs or fleas or etc. through which the vaccination can be transmitted. Therefore, the one very powerful method and the most difficult method to break the transmission, the human transmission of the virus from person to person, is through human transmission. And that is why a physical, social isolation, wearing of masks, hand washing to break the chain of transmission is so very important. And therefore, vaccination helps to also reduce the transmission from person to person, and therefore the epidemic waves that is running and wreaking havoc in families and communities and nations can be broken. The chain can be broken through vaccination. So very briefly, colleagues, that's the brief synopsis of answering the question that you had asked, Chairperson. Back to you, Chair.
Thank you very much, Professor. That's very helpful. And I think you remain the professor. Yes. Now there will be another question. I think this area of faith-based science is an important one that people need to, because all the questions that have come through that we're receiving. One is, might there be a particle in the vaccine that resembles a chip, and how true is this? Because people are suggesting that there is a microchip in the vaccine. Can somebody who understands vaccines maybe follow up after the professor?
Hello, I'm Salim Parker from Cape Town. Thank you again for the invitation. We have Dr. Chena, who's a microbiologist, who's an expert specifically on the vaccines as far as COVID is concerned. But what we need to emphasize to people, just to add to what our previous speaker said, Dr. Jinabai, is that are vaccines effective? Now, according to the World Health Organization, just between 2010 and 2015, 10 million lives were saved. That is a significant number that we have to take into account. And on a yearly basis, we're looking at about 3 million lives that are being saved purely due to vaccination. So in addition to the provision of clean water, as well as the advent of antibiotics, vaccines have been proven to be the most potent intervention as far as the lives of human beings are being saved. What are the other benefits? It's already been indicated that it prevents death. Absolutely, especially amongst children. We notice that the mortality in children due to vaccine preventable diseases has been really coming down significantly. But vaccines has also led to the eradication of certain diseases, such as smallpox. I mean, I'm a bit too young, I think, to remember much about smallpox, but we're on the verge of actually eradicating polio. And the biggest obstacle to that is actually religious groupings who do not want to take those type of vaccines. And thirdly, we must also consider something like polio prevents disabilities. So we're not only preventing deaths, but like polio, someone can, for example, be disabled for the rest of their lives. So vaccines has been proven to be effective, proven to be saving lives. And just to indicate what happened, for example, in the DRC, Democratic Republic of Congo, when there was a interruption in the supply of measles vaccines, which all of us, our children have had, because there was this interruption in 2000, 6,000 deaths occurred in children due to measles outbreaks there. 6,000 deaths that could have been prevented if there wasn't an interruption in the vaccination program. As far as that specific question is concerned about the microchip, there's absolutely no truth to that. There's absolutely no proof of any of those type of interventions in the vaccines. Where it started from, no one really knows. But someone just states a fact. My daughter she's a teacher. She's in her 20s. She had to go for a Johnson & Johnson vaccine, and someone told her, "Oh, don't you know that it causes infertility?" Now, she's just got married. Of course, she wants to have children. Where these type of rumors come from, nobody knows. But someone just states it causes Johnson & Johnson causes infertility, and it spreads like wildfire. Someone states there is a microchip being implanted in there, and it becomes fact. And this is the type of issues that we are dealing with at the moment, where it's difficult to separate the fact from fiction because of the way that social media has actually aided the spread of such misinformation. Just my few cents worth before the other experts speak on the COVID vaccine itself, which a lot of people have issues with because of the way it's formulated, like messenger RNA and so forth. But there are other experts that can add some more light to that. Thank you for the time afforded to me.
Thank you, Dr. Parker. Thank you. That's very helpful. And I think that may be a clear follow-up question there has to do with the tinkering with that the vaccine is supposed to do. I don't know if Dr. Chania wants to address that.
Good morning to everyone. All protocols observed. Yes, there's a lot of misinformation and perhaps misunderstanding about the technologies of vaccines. And I think people have been overwhelmed by all the WhatsApp messages that are flying around from a lot of sources that are not actually scientifically valid. Just to kind of give you an understanding of the different types of vaccines, probably the one that is the most in use would be the Pfizer and the Moderna vaccines, which use the new technology of messenger RNA. And a lot of people have come up with the incorrect idea that messenger RNA is going to alter your DNA. And this has led to a lot of fear. Probably what they need to understand is that messenger RNA is like its name says, it's a message that goes into the cell, but it does not go into the DNA. So our DNA is kept very separate from the rest of our cell components. And so the messenger RNA has no way of interacting with the DNA. It is separated by a very selective barrier. And so people should not fear that taking this new type of vaccine is going to change them into some kind of mutants or going to alter their DNA and going to lead to problems like infertility and so on. Messenger RNA's role is to go into the cell, to provide the message to tell the cells to start mounting an immune defense. And the good thing about the messenger RNA is that it does not last for a very long time. The body has ways of eliminating cells depending on their function. And so the messenger RNA gets degraded very quickly. And so it does not remain circulating in your body for long periods of time. The other issue regarding the Pfizer and the Moderna vaccines has been the nanoparticle that is used to deliver, and that's a fatty lipid sort of bubble that encloses the messenger RNA and allows it to be, delivered to the cells to start the immune response. This nanoparticle bubble also gets degraded very quickly, within a week at least. And so it's not going to be, these molecules are not going to be circulating inside your body for extended periods of time and bringing about any changes to your DNA or to the makeup of the cells. Yes, this is new technology. A lot of people have been very concerned that it happened too quickly. But what they perhaps don't understand is that for the first time in our recent history, there has been this pandemic, and there needed to be a very strong, coordinated global response, which has not previously occurred. So the vaccines related to this group of viruses has been in sort of development since the SARS outbreaks in the early 2000s. And so we've already had a lot of information on how to develop vaccines that would be effective to deal with the coronavirus. The other issue is that there was a very strong government support, and this was a global government support in terms of resources, funding, and so on, because of the fact that it is a pandemic. And so people stopped everything else and they focused on getting vaccines that would be effective. So these vaccines have been developed very quickly within a 1-month period, but this doesn't mean that the scientists took shortcuts. They have been following all the steps that are required for normal vaccine development and ensuring that they are safe in terms of the trials. The difference in the trials is that a lot of the trials overlapped because of the need, the need for a rapid development and release to the global community. So I don't think that the public should be concerned that, you know, it was too quick a process. I remember this was science minds coming together and really working very diligently, long hours to try and ensure that, you know, the scientists have done their bit to try and assist the global population. The other vaccine that South Africans are very sort of familiar with would be the AstraZeneca and the Johnson & Johnson vaccines. And all of these vaccines have different efficacies because they all have different ways that they've been developed. But all of them are targeting the spike protein. And so one of the good things, and this is, we saw this in the South African context, is that the authorities are obviously taking note of the issues that are related to the vaccine. So the efficacy, also issues around side effects, and side effects happen with all kinds of medication, not just with vaccines. I think people are overly stuck on vaccine injuries and vaccine adverse effects, but the adverse effects that are being seen are being noted. Definitely, they're not being pushed aside, they're not being hidden. As soon as there's an issue that is raised, for example, the blood clots with AstraZeneca, the myocarditis with the Pfizer and the Moderna vaccines, immediately investigations are being done into this. And, you know, so people should not feel that they're being put at risk. They should have faith in the fact that the scientists are doing all they can, because it's also their own families that are being affected by this pandemic. And so they're not going to introduce something that is going to put the entire world population at risk. There's this common conspiracy theory that Bill Gates wants to introduce chips, wants to control population fertility, especially in Africa. I mean, these are not realistic pieces of information that are circulating. People just send WhatsApp messages and then they go viral, pardon the pun. But, you know, really, when you want science information, consult your doctors, consult, you know, websites which are really science websites, CDC, the NICD. There are many resources that are actually available to the public that put it in layman's terms so that it does not become too sciencey. And I think that we've all been taking vaccinations. I remember getting the vaccinations at school. My parents took me for vaccines previously. And, you know, nothing happened to us. We didn't become mutants. I don't see why suddenly the COVID vaccine is different from the other vaccines. anecdotally, my father received the polio vaccine when he was a young boy, and he saw people dying from polio. I'm sorry, from smallpox. And this was something that was actually, an eye opener for him. And this was, in India many decades ago. And he's one of the strongest, most passionate people who will advocate for vaccines to be used, because he's seen the effects of epidemics and how they impact people. This is something that we haven't seen in recent times. And so people become very gun shy or wary of taking the vaccines. And so I think people need to have faith in the scientists. They're not going to do things that are going to willfully harm people. Side effects do occur, but they're occurring in a very small percentage. They're being documented, they're being investigated. The issue of liability of the vaccine companies is also very much a conspiracy theory thing. Again, all companies want to protect themselves. This is something that is true for any type of medication, especially in societies where lawsuits are very common. So these companies will also attempt to ensure that they are protected from legal action. They stand to make a lot of money, yes, that is without a doubt. But at the end of the day, we have a pandemic, and the governments are doing the best that they can in order to ensure that the populations receive the vaccines that are going to be effective. Of course, there are variants, and so this is something that the viruses do, they mutate, especially when humans don't follow the social distancing protocols and the non-invasive interventions. But this is something that is out of our control. The only thing that we can do is monitor the situation, understand what variants are out there, look at how vaccinated people are responding to these variants. And this is a developing situation, so more and more information becomes available with every day that passes. And so we're going to learn more about the vaccine efficiency. We're going to learn more about the viruses as well. And hopefully we'll come through this pandemic wiser and still with all our loved ones intact. Thank you.
Hello. I guess that's the end of your presentation, Doctor. Thank you very much. I am conscious that we ought to be transitioning to media time, and where Kutalani Khumalo conducts that conversation. I want to answer a couple of questions that put, at least to flag some of the questions that have been put up for us for consideration. One of them is in the charts. It says something about the need for religious practitioners or those who conduct funerals and do pastoral administrations, why they are not vaccinated as a matter of priority. Please be aware that this forum, the Religious Forum Against COVID, made a firm decision, even though all of us in our different platforms have made that request. But this forum actually made that as a matter for communication, formal communication with government. And we did communicate it at an occasion recently with the government leaders. And it was very forcefully presented by Chief Rabbi Warren Goldstein. Now, the response has been something along these lines. One, we need to know who the ministers are, these practitioners are, because there isn't a registration place where they all are. We know who the teachers are, we know who the nurses are, but we cannot say who. When we're planning for these practitioners, we can't say how many vaccines we should prepare in what parts of the country, because there isn't a common space for that is provided for. And our response has been to say, all religious communities in this country, does not matter if it's a single pastor, all of them have got some kind of organized affiliation of one sort or another. It might not be necessarily known by everybody now, but once we have this commitment, we would encourage that all those organizations that exist should be able to present the pastors, ministers, priests, whatever title they use, imams they use, the imams that they have in their system will be able to be presented in the same way that with the people with comorbidities, you're using other systems of registration, because there isn't a register of people with comorbidities. So it should be possible that would ever come out. The second thing that they've raised as an issue is that they want to make sure, again, that there's an equitable treatment of all traditions. And that's exactly why we are saying that every group, whoever they are, if they must organize themselves in a way that makes this possible for it to be accommodated. I think that in the main, that's where the issue is, and but a promise has been given for an engagement on this, and we shall be having those meetings with them as soon as possible. The other question, of course, that is in the platform. The other question that is in the platform is a question on people that are wanting to make contributions, and I do not know if you can read all the in the Q&A, but there is a Pastor Zahita who has made some who had offered some opinions there that I would like you to read for yourself, so that I don't have to read them out. They agree, who agrees with Rabbi, or that we cannot speak for God, but he does address some of the things that we've been talking about. Please read that for yourself. I also know that there's a pressing question about whether if I take a vaccine, I will not be impacting negatively on my faith. And that's a question that has come from somebody in the believers in Christ community. And I do not know if quickly Dr. Nzimela might want to just say something about that on behalf of the Archbishop, and then we move on to the media, please.
Thank you, Bishop, for the opportunity. That's a very interesting question to ask. If I take the vaccine, will it not impact my faith? And the background of it is that some religious or religion believe that you cannot assist or support God in any way. So if you take any substance other than just prayer, it means you are then declaring the Lord or the God to be weak because he cannot heal you. But there are a lot of medicines that are out there that people take. People take flu medication. People take traditional medication, and that is viewed as being correct because everything that God has given us in terms of fulfilling the earth is there for us to use and utilize, including the trees, which are trees that give us medication and healing. So it doesn't affect your faith at all if you take any of the vaccines. Some of us grew up taking vaccines, so by the mere fact that you became or converted when you were older, you already have a road to health chart that says you've been vaccinated. So, and that cannot count against you in terms of the strongness of your faith. So the vaccine does not affect your faith at all, because this is just an introduction of a small particle, and everything that the vaccine does is mostly your own body creating its own reaction. So everything is more of your internal perspective. So the body mounts a response that protects you as an individual. So there's nothing external that is being introduced into your own body. That's why I'm saying, especially with the new vaccines, because this is just a messenger RNA that stimulates your own cells to create the spike proteins that the body is supposed to react against. So it's easy. So at this point, we really encourage everyone to take the vaccine. especially if we want to achieve what we call herd immunity as a country, because once we get to herd immunity, that's where you get full protection of the vaccine, where even the unvaccinated will now be protected by the group that is vaccinated. So if everyone is vaccinated, then the few that are not vaccinated will be protected. But we still encourage everyone to take the vaccine. Thanks, Chairperson.
Thank you very much. Because you're a pediatrician, I should ask the other question that says, would you encourage your kids to take the vaccine if it was available for children? Considering the increased infection amongst children.
Okay, one needs to look at the background. If you're looking at COVID vaccine in the pediatric population globally, we're seeing very little numbers. The numbers are very low, and kids are not prone to a severe infection. Most get mild infection. Very few are getting severe infection, and the mortality in the pediatric population is very low. So this question, one has to answer it in about two different folds. One is, what are you aiming to achieve? If you're aiming to achieve herd immunity, like if you're looking at the studies in Canada or the study in the US of A, then perhaps vaccinating your kids can help you get a herd immunity. But if you look at the population of the kids or the children in South Africa, we can achieve herd immunity without vaccinating any of the kids that we have in the country. So if all the adults and the youth are vaccinated, that on its own will give us a high enough herd immunity. So based on those two, currently I would say if the vaccine was available for kids, not yet. But if all the adults have been vaccinated and only the kids are left, then the answer at that point will be yes. There have been some fears with the vaccine, especially in kids, with the kids having a higher number of developing myocarditis, which is your heart infection, compared to the general population. Those studies are still under investigation, so we're waiting to see what will be the end product, especially your Pfizer and your Moderna. So at this point, we're not going to be vaccinating kids because it doesn't make sense to vaccinate kids currently when we have so many adults who are at higher risk, who get more severe disease, who are not yet vaccinated. Maybe in 4 or 5 years' time, when everyone else has been vaccinated, then yes. It's a bit different when you're now speaking about teenagers, because teenagers are a higher risk, they're a bigger group and they're quite busy. So with teenagers, we'll advocate for teenagers to be vaccinated, but kids, no, currently. Thank you.
Thank you. That speaks to my ones. Ms. Kumalo to take any questions from the media.
Good morning, everybody. Thank you very much, Bishop Malusi. I offer the opportunity to any of the media who have been able to join us in this section. If there are any questions that you would like to put forward, there are options that you could use. Firstly, you could put the questions into the Q&A functionality at the bottom of your screen, or you could type them into the chat and we can relay to whomever you would want the questions to go. So I would request that each journalist would indicate which publication they are with or which media house they are with, and also to whom the question is being directed. Bishop, while we were talking about what was in the Q&A section, there's a question from Klopas right at the bottom that says, how best can we assist the country to reach herd immunity as early as possible? I've taken the liberty of correcting one or two of those words, but I think it definitely is a question that could be put forward to our medical professionals on the platform. How best can we assist the country to reach herd immunity as early as possible?
I think I can just say for the purpose of this forum of our religious communities to achieve exactly that. That it is a forum that we have created so that we can collaborate amongst ourselves as faith communities to make sure that in our communities and their neighbors, there is enough understanding of what needs to be done, and that for the love of the neighbor, we all drive ourselves to a point where there is community-wide. It's really a social issue. It's not a medical issue. It's a social issue. It's a community issue. It's about all of us communicating with one another. I mean, all these things need all of us to participate. But I think that herd immunity will come because everybody gets everybody else to participate.
Thank you very much, Bishop. I have not seen any queries that are coming through from any of the journalists, but just for their benefit, this entire session has been recorded, and the recording will be made available for any media content that would be packaged for broadcast and online purposes. So, Bishop, with that being said, being cognizant of the time as well, I would recommend that if there are any final remarks that would need to be taken, let's allow that to happen. And I will continue with any media engagement direct with our panelists and with the journalists as may arise.
There is a person whose hand is up by the name of Teacher 9, Jamia Online. I don't know if that's a media question, whether it's an attendant who would like to ask a question, and I'm not sure that they can actually speak into the program, except writing up the questions in the platform. Can you advise?
Let me have a look.
There's a hand that's up, and I don't know.
Yes,
how
I see that. I see that.
There is a question in the meantime that comes from Bishop Malloy about the readiness of the health facilities to deal with the affected communities. I mean, today we're sitting at 19,000 plus infections over the last 24 hours. This tells you the urgency of the campaign that all of us must get into. Because there will be no places in hospitals unless we bring down the infection rate. And we do this by doing what we ought to do: mask, distance, hand hygiene, ventilation, even during the winter. Those things remain absolutely essential for us to continue to do those. Even after vaccination, we must continue to do that. And so it's about communication and making sure that the next person appreciates that I put on my mask, not because I put on my mask because I fear that I may be a carrier and I don't know it, and I need to protect you. It is for your sake that I do this. There's a beautiful program proposed by the United Nations community here in South Africa that they're piloting. They're getting young people to really say that I will put on my mask for my grandmother. I'll put on my mask for my neighbors. I'll put on my mask for my colleagues, because you don't know when you have the infection. That's really what this is about.
Thank you, Bishop. I see that we do have Othman Chilungo. I'm not sure if there's a comment that you would like to make or to speak. Please unmute so that we may hear you.
He's a communication officer from the Muslim Judicial Council.
So kindly unmute so that we may hear you. We can see you wanting to make a comment.
Hello, can you hear me now?
Yes, sir, we can. Please go ahead.
All right, this is Maulana Bishop and other religious leaders. It is Maulana Ibrahim Bam from the Jamiatul Ulama and the Council of Muslim Theologians. Just
Thank
very
you.
briefly, there was, in response to one of the questions that were posed, that is it against faith to be able to take the vaccine? And from our perspective, in our theological perspective, and I'm sure other religious leaders would also and could weigh in, we do not look upon it as something against our faith. And this has been very beautifully explained in an incident in the time of the Prophet Muhammad peace be upon him, that a person came with a camel and he left it untied and he came and visit the camel and he said, I rely upon the Almighty. And the Prophet Muhammad, peace be upon him, said, go and tie your camel and then place your trust in the Almighty. So one of the ways of trusting and relying upon the Almighty is to adopt the means, whether it be medication, whether it be getting married for the sake of children, even if the power of the Almighty is that he created Adam without the agency of a male and female, without the mother and father. It is not the normal pattern of the Almighty, which requires intimacy with our wives to bring children into the world. So I think in response to that is it's important for us to adopt the means so that that's the way to rely upon the Almighty. From our perspective, we have said and we have issued a statement that there is no impermissible ingredients in the vaccine for people of the Muslim faith. And one of the one of the great principles of religion is to ask people of expertise if you do not know. And in this particular regard, the experts are the doctors and the scientists who have told us to take the vaccine to be able to create a herd immunity and to protect ourselves from serious infections. So I think that is just briefly a response on is it against faith to be taking the vaccines. Thank you.
Thank you, Maulana. Thank you very much. I'm glad because I was looking for you and I realized that you came in through Putman's platform. Thank you very much. We are actually reaching a point of closure, but there may be the question that has been raised by somebody who put the question over the burnout of the clergy and how they need to be ministered to. Let me just say that that is a matter that has been raised by others, and that the Religious Forum will be looking at that and how we can support the practitioners in our communities. The Religious Forum meets every Thursday afternoon, and this is the time when we look at all the things that we need to do, and the communication team meet on Tuesdays, again taking the cue from the leaders and then unpacking things that need to be done. There is a request for religious leaders to get themselves onto images that can be photographed. If all of you can at one time do what I've just done now, of having your image showing, so that all the religious leaders can be photographed by those who need to do so. If you don't mind, please, let's do that now. Maulana Pam, Maulana Ali. Ravi, where's we're missing the Rabbi, we're missing the Maulana from Cape Town and from Johannesburg.
I'm here.
Maulana. Oh, yes, Maulana Bam is here. Now, there's a remark that says a band of men. And that is something you need to take to your religious communities, why you have a band of men as religious leaders. She qualifies it by saying good men, but goodness does not reside only in men, especially because the majority of the world is women.
It was meant to make us all smile so the picture looks better.
Thank you. We are now going to be going to the closing that I would like to just make a few remarks. We have said earlier that the religious leaders have committed to a week of prayer. And that week of prayer is for next week to pray, particularly because of not only the fact that we are in the third wave, but also because of the intensity of grief, the challenges of people not being able to get to access to hospitalization, and maybe even to pray for a greater recognition of the kind of responsibility we all have to drive down the infection rate with everything that we can. And so that week of prayer takes on two forms. One is there will be a collective prayer of the religious and interfaith prayer that our communication team is working on, and we will confirm the time. But I think the suggestion is that this be for Tuesday next week. And we just need to confirm the time so that we can confirm the time with the leaders, and then we can announce the time. Then apart from that, all our traditions in our normal worship times for the rest of the week, we shall then use that time in all our faith traditions so that it becomes a week of prayer against COVID. And so that's what we're doing next week. But the central one is going to be the one that all of us participate in, and that's going to be on Tuesday. The time will be declared and announced. We just need to confirm it with the leaders. There is a proposal, but that proposal has not yet gone to the leaders. So because of that, we can't announce it here, the actual specific time. I think the day has been agreed by the communication teams. The last thing that I would like to say is that this being a launch, it is the beginning of a process. Every week we're going to be doing something. There will be prayers from our different traditions. There will be prayers. There will be messages. There will be interaction. The questions that were raised here are not the end. More questions have to come. The surveys are continuing, and there will be ways in which these are handled in the various platforms of our traditions. If you are Hindu, you'll find in the Hindu tradition, there'll be communications there. If you're Muslim, you'll find a communication there. All of these things will be coming from across all of us. And we really want to make sure that we hold hands. Mulana Abdul Ali suggested that we have a joint message that goes to sports platforms at the beginning of a match, sometime during the halftime. We need to look at all those things and various ways in which we can make sure that everybody has got the right information and we can combat fake news. There are people who have got a whole industry of fake news. This, we believe, can be combated if we all work together to make sure that we save lives, because it is about saving the lives of South Africans, which is the pastoral responsibility, the spiritual responsibility, the divine commitment that all of us have in all our traditions of faith. I say now, thank you very much. And I believe that that it being noontime is a good time to say thank you and goodbye. We will be communicating more and more as time goes on. This is the beginning. Every week we're online doing something that you need to participate in. Thank you.
Thank you, Bishop.
Thank you, Bishop. Thank you very much.
Thank you, Bishop. Thank you. Bye-bye.
Thank you. Thank you, Bishop.
Bye.
Thank you, Bishop. Bye.